Hi, Real Moms. This is Dr. Paul here, and I want to tell you 3 short stories about how to prevent cavities in your children that your dentist likely never told you. See, I'm the author of Real Mom's Dental Pocket Guide, Cavities, and some other upcoming books, and today we want to talk about this. This is a child, basically a 3-year-old, that has teeth that are so infected that the only option is removal. Now, sadly, I've had the opportunity to do that 3 times in my life. Take 3-year-olds and remove every tooth in their head. That's 20 teeth per child. So I want to tell you how that came about. A lot of people have heard about bottle cavities. Bottle caries is the dental word for it. And they think that it might have to do with putting juice in a bottle and putting the baby to bed at night, that sort of thing. But I'm here to tell you that human breast milk can cause huge cavities, can cause this if you don't be careful about how it's applied. So when you put a baby to bed at night, they usually fall asleep. Listen, I'm the father of 4 children. I've got kids. I've been down the block with this. And when you put anything in the bottle besides milk, they will fall asleep with that bottle in their mouth, and whatever is in there drips on their teeth all night. And it's the timing, the amount of time, the application of any sort of fermentable carbohydrate. That means simple carbs, including lactose in breast milk. So if you put that in a bottle and you give that to your baby at night thinking it's the best thing to keep them quiet, hey, listen, I understand wanting to keep babies quiet. You're never closer to insanity than the sleep deprivation you get with small children who won't sleep. I've been there, done that 4 times. So here's what I suggest. Only water, if anything at all. Babies are trainable at a very young age to do this, but let me tell you what happened with this one lady. She had her daughter that had a mouth that was nothing but stumps. There were no teeth. There were just roots, and they were infected, and they were swollen and bleeding and pus and all the stuff no mother would ever wish on her child. And so the only thing we could do was take them out. So we had her go over to the facility, and we put her to sleep, temporarily, of course. We put her under anesthetic, and the entire procedure took about 5 minutes. And that's all it is. And I had to remove all 20 roots that were so infected, and we sent the girl home. Now, things happen really, really quickly in children. Those cavities can happen very fast. Like I said, the child was only 3 years old, but they heal quickly too. I don't know how you would feel if you just had every tooth in your head removed from your head, but the mother called me later that afternoon, and she said, my daughter's playing in the sandbox. What should I do? I said, let her play. Kids heal quickly. You can't believe how fast they heal from something as kind of traumatic as having 20 teeth removed from their head. But it relieved so much of the infection that little girl went on playing that afternoon, and she was fine. Very little painkillers are needed for that sort of thing, and all the rest. Now, on Thursday at noon, I'm going to be back on Facebook Live, and I'm going to tell you the second story of this series. And this is about a couple of teenage boys who ate pounds of candy per week. I mean pounds. And neither one of them ever had a cavity. And it wasn't magic, and it wasn't luck. There was a definite method to the madness. So come back on Thursday at noon Mountain Time, and we'll tell you that little story. And thanks for being here, and happy holidays.